COVID has put a spotlight on that insurance gap here that we have in Florida.
Regulations are very light here in Miami.
A lot of people die, but that's part of what the virus is. It's like something you can't avoid.
Hello and welcome to American Views, France 24's special coverage in the lead up to the 2020 U.S. presidential election. We're going to take you on a 10,000-kilometer road trip to 6 key swing states that will be critical in determining who ends up in the White House. And today we're going to focus on the state of Florida. Now, with a whopping 29 electoral college votes, the Sunshine State has long been a coveted prize, and it's rare to win the presidential election without winning Florida. Diverse and unpredictable, it's notorious for extremely close calls in the race to the White House. Now, here's some other key features to know about this crucial swing state.
Dubbed the Sunshine State, Florida borders the Gulf of Mexico and has a semi-tropical climate. Florida has the longest coastline in the U.S., with more than 825 miles of beach. It's known for the mangroves and marshes of the Everglades, a UNESCO World Heritage Site. They're home to diverse wildlife. The third most populous state, Florida has more than 21 million residents who live mainly on the coast. Its capital city is Tallahassee. Florida has more retirees than any other state, over 20% of its population. There are also large Latino and Cuban communities. Tourists are drawn to Florida's beaches and theme parks, bringing in tens of billions of dollars in GDP each year. Florida is worth 29 electoral college votes. While retirees generally vote Republican, Latinos tend to the left. A wild card, Florida is a long-time swing state. In 2016, the state voted 48.6% for Donald Trump.
It's hard to overstate the importance of the coronavirus pandemic in this presidential election. Remember, the United States continues to top the list of countries with the most cases, and it's the topic on everyone's mind, like here in Miami, Florida.
Regulations are very light here in Miami compared to in other countries and even in other states in the U.S. So, I mean, we're biased. We're nurses.
Yeah, so that's the thing.
So,
we are biased. I understand that the economy took a hit, and I feel like that's pretty much, creating the decision of opening everything up so early because, in fact, we are still having cases. It does get bad, and I don't think that they should have opened everything up already.
I mean, a lot of people die, but that's part of what the virus is. It's like something you can't avoid.
I think that it just hasn't been handled correctly. I think that it could have been handled in a different way from the beginning.
Florida has seen one of the biggest surges in COVID-19 in the country. In fact, this summer, it was the national epicenter. Minority groups like African-Americans and Hispanics have been particularly hit hard by the virus. And that's true here in Florida, which has the third largest Latino population in the nation. It's also where, proportionately, there are the most retired people, a group that's particularly vulnerable to the virus.
At 84 years old, Richard Glom's health is frail. As a senior, he belongs to the group most at risk for severe illness from COVID-19.
Well, the numbers in Florida are absolutely unacceptable. They're ridiculous. I think that there are a lot of us Republicans that are frustrated with Mr. Trump.
Glom and his wife are lifelong Republicans, but in 2016, they chose not to vote for the first time in their lives. This time around, they've decided to support the Democratic candidate. They're worried about the government's handling of the coronavirus, especially in their state, Florida, which has the third highest number of cases in the country.
When you get sick, at our age, we both have medical problems, so that our survival rate would probably not be too good, and we'd also be endangering any of the family, any of the children, if they decided they needed to help us.
The pandemic has brought the question of access to health care at the forefront of the presidential campaign. Democratic activists like Barbara Grimm are trying to get voters to the polls with a special focus on health care.
Is health care something that's important to you?
Very important.
What do you think about what's happening right now with the Supreme Court and the Trump and Republican administration trying to destroy the Affordable Care Act?
They're just ridiculous because they would leave over 30 million people without access to health care.
The U.S. does not have universal health care, and many Americans rely on private insurance plans that are often expensive. In 2010, then-President Barack Obama passed the Affordable Care Act, which mandated every American to sign up for basic health coverage. But the Trump administration struck down the mandate, and Florida is now trying to throw out the law altogether.
With Obamacare, people were able to get preventative care so that they didn't have to go to the emergency room and didn't have to suffer permanent physical ailments. The Republicans whittled away at the Affordable Care Act to where it's been very hard for people to afford.
The COVID crisis has only made matters worse. Since March, unemployment rates have skyrocketed, and for many Americans, losing their job has also meant losing their health care plan. That has left about 30 million people without any form of medical coverage. So to help those in need, this health clinic in Orlando is providing free medical services, though most appointments are still taking place online because of the pandemic.
Now more than ever, we're seeing a new wave of patients coming in, folks who had those amazing jobs, really stable jobs the year before, now have lost that, and they've lost, honestly, a way to find health care. COVID has kind of put a spotlight on that insurance gap here that we have in Florida.
Hospital costs in the U.S. average nearly $4,000 a day. That's about 5 times more than in France. The U.S. spends more than 17% of its GDP on healthcare, more than any other developed country. Yet studies show tens of thousands of Americans die each year because they don't have access to health insurance.
To better understand the impact that the coronavirus pandemic has had here in Florida and in the United States, I'm with Dr. Carlos Torres Vieira, an infectious disease specialist. Thank you so much for being with us today. You have been on the front line working to fight against the coronavirus here in Florida. In fact, you even had the virus yourself. Why do you think it's been so bad here in the state of Florida?
There are several factors that I think play a role here. One thing is, in general, in the United States was bad because I think we don't have a coordination between the different parts of the health system. The health system in the United States is very fragmented into the private, public system, and within the private, different type of systems. So that doesn't allow to very much of coordination. Besides, the states and the federal government has been uncoordinated as well. So that also had an impact. The final thing is that I think people here are more relaxed than in other parts of the United States. We are more, a lot of a Latin population. We tend to be more family reunions and do those kind of things and comply less with the recommendations of social distancing and use of the mask, etc.
You mentioned the Latin population here in Florida. Why have minority groups like Latinos and African-Americans, why have they been hit harder than other groups?
I think, again, several elements in there. One is that those populations tend to live in groups, the family family group are more than 2 people, usually a huge number of people, including sometimes several families living together. The same happens with the worker populations in the fields, the farms and everything. Those people live all together, so to facilitate transmission. And the other thing is that this population, usually the field of work of this population doesn't allow them to work from home, so they were more exposed all the time.
And the pandemic has come amid a broader, heated debate about affordable health care here in the United States. Do you think the pandemic has exposed flaws in the system?
Obviously. has exposed the lack of coordination between the public system and even the private system. We have a huge part of the population that is not covered by the health system, and they try to avoid the hospital as much as they could. It's also very difficult to follow them once they get to the hospital and they are released. So all those elements obviously are playing a big role in controlling this pandemic. It's very fragmented, as I said. It's very fragmented in terms of different systems that they don't work together.
And as a doctor and an expert, what do you think would be the ideal healthcare system here in the United States?
I think I would love to have a system that is more there is more coordination, where there is a public system that can, people who have not the money to buy an insurance can have a health system that they can rely on. Whether this is a combined system with private and public, I don't know, but certainly something that would allow the coverage of all population in the country.
And you're on the front line against the coronavirus. Do you think that the American system is ready for the surge in cases that we're expecting this winter? Do you think it can handle it?
I think we probably yes, but I would be careful about that because we thought the same thing when we started. I think we are prepared in terms of the medical preparation, in terms of instruments, in terms of equipment, the labs, etc. But again, we expect a huge surge. We are thinking that people are not very compliant with indications, so hospitals can go very easily into the mood of New York, basically, where we are going to be overcoming the hospitals. So that's what I'm afraid of. I think physicians are more tuned with what works and what doesn't work. We have some medication that work, etc. We understand better the disease. But in terms of the surging in the request for medical help in the hospital, I'm not sure that we are ready for that yet.
Well, thank you so much for all your input, Dr. Vieira. It's been very interesting talking to you.
Thank you.
U.S. President Donald Trump has drawn fire for his handling of the coronavirus pandemic nationally. In fact, he himself contracted the virus in early October, and 65% of Americans believe he could have avoided getting sick had he taken COVID-19 more seriously. Interestingly, his first stop back on the campaign trail after recovering was here in Florida, proof that the Sunshine State is crucial in this presidential election. Well, that wraps it up for American Views. Thank you for watching, and stay tuned to France 24.